In the last class, we read something about immunity. So anyone, what is immunity? What is immunity? What is immunity? It is the resistance offered by the body against any infection or antigen with the production of specialized cells or antibody. So we can classify immunity into many different categories, but this is mainly for our understanding, because all the types of immunity are dependent on one another. So in one way we can classify into acquired and innate immunity. So acquired, we acquire this after birth, and innate, we are born with this kind of immunity. So acquired immunity can be again classified into active and passive. Active immunity into natural and artificial, and passive into again natural and artificial. So natural active immunity, when someone is infected with some kind of organism or bacteria or virus, after the infection our body produces specialized cells or antibody against that virus. So this is active natural immunity. Then we come to active artificial immunity. So can anyone tell me what is active artificial immunity? So this is due to vaccination. So vaccine, we take an organism, then we in the laboratory we convert it into a harmless organism, or take a part of the bacteria or virus and then manufacture a vaccine. And when we inject the vaccine, our body is stimulated to produce specialized cells or antibody. Then we come to passive natural. So there are 5 kinds of immunoglobulin. GAMDE. Generally, only IgG can be passed through from the maternal circulation to the fetal body. IgG. So with the help of IgG, we can have natural maternal antibodies. And we can also separate the antibodies from another person, from the blood, and then inject this antibody into another person. So this kind of antibody is passive artificial antibodies. So here we can see this is a natural infection, and here it is vaccination. We can receive from the maternal blood, and another is we can separate the antibodies from normal blood and inject into another person. So there are 2 terms, one is specificity and memory. So what is specificity? So every antigen is different, and our body can recognize a very minor difference in the antigen. So if we inject, suppose 100 different proteins into a person, so the person will produce 100 different types of immunoglobulin or antibody against each of these 100 different proteins. So this is called specificity. So if a person have IgA blood group or A blood group, so what kind of antibody the person has corresponding to this A blood group? A blood group person will have what kind of antibody? Anyone? Anti-B. A person having blood group B. So what kind of antibody will he have? Anti-A. And these antibodies are natural antibodies. So can you tell me what will be the among the 5 types of immunoglobulin? What kind of immunoglobulin it is? The antibody. The blood group antibody. Did you get my question? Did you get my question? We know 5 kind of immunoglobulins. GAMDE. So if a person is having blood group A, what kind of antibody will he have? B antibody. So among the 5 groups, which group this antibody will be classified? These are generally classified under IgM. And another thing is memory. Once a person is infected with an organism, our body will produce specialized cells or antibody. When the person is affected with the same organism the second time, it will produce more cells and antibody at a much faster rate and in much huge amount. So the first time it is called primary immune response, and it is mainly done due to IgM. And the next time when the person is affected with the same organism, it is called secondary immune response, and it is due to IgG. And during the second time, the memory cells will act. In the primary response, the memory cells will be produced so that the immune response is much faster in the secondary immune response. So this we already know. Blood group A will have anti-B because the antigen is A. For blood group B, we have B antigen, so we will have anti-A antibody. When we have both the antigens A and B, we will have no antibody. And when there is no antigen, both the antibody will be present. So antigen. So any substance that invokes or induces the production of antibody or specialized cells, those antigens, those are antigens. And the special part of the antigen which interact with the antibody is called epitope. So here in this graph we can see here a person is exposed to an antigen or bacteria. So it takes some time to start the immune response, and then it goes to peak. Then after the person recovers, this primary immune response comes down, and when the same person is infected with the same kind of antigen or bacteria, it is called secondary immune response. So this phase you can see it takes some time, and here after the second time exposure there is no such length. So the primary immune response takes time much more than the secondary immune response, and the antibody produced in primary immune response is much less than the secondary immune response. So here the same curve, but here we can see in the primary immune response there are majority of the immunoglobulins are IgM. And then this IgM is converted to IgG. This is called class switching. So IgM class is converted to IgG. And after the end of the primary immune response, there are some cells produced. They are called memory B cells. So we know there are two kinds of lymphocyte, B lymphocyte and T lymphocyte. So from which kind of lymphocytes the antibody is produced? B lymphocytes. So here we have the memory B cells. So when the person is infected with the same bacteria, the memory B cells will be stimulated. So the amount of immunoglobulin produced will be much higher. And this, the majority of the immunoglobulin will be IgG type. So in the primary immune response, it was IgM. And in the secondary immune response, it will be IgG. So here, this is suppose a bacteria. So bacteria can have different antigen present on its cell surface. Suppose these three are different antigens on the bacteria. So these are antigens, but a specific portion of this antigen will interact with the antibody. So the part of this antigen which interacts with the antibody is called epitope. And the part of the antibody which interacts with the antigen is called paratope. So previously we read about the immunity we can classify into active and passive, innate and acquired. But we can also classify it into cell mediated or cellular immunity and humoral immunity. So here the cellular immunity is mainly controlled by the T lymphocytes. And the T lymphocytes originate from the thymus. They are produced in the bone marrow, then they pass through the thymus where they are matured. So after it passes through thymus, it also passes through the lymph nodes. So 80% are T lymphocytes and 15% are B lymphocytes. And T lymphocytes mainly control the cell mediated immunity. So here in case of any immune response, first the infection or the infected cell will be engulfed by a macrophage. Then the macrophage will help the T cells to recognize the bacteria or the antigen. Then the T cells will divide. More T cells will be produced. And then these T cells will destroy the infected cell. So what kind of immune response is this? Cell mediated, because the T cells are active. So here we come to humoral immunity. So the B cells, the name comes from bursa of Fabricius in birds. And this similar organ corresponding to humans is lymphoid organs associated with lung and gut. So here in the bird we have the bursa of Fabricius. So it is a sac-like evagination from the cloaca. So here we can see similarly a macrophage or associated with the T helper cells. So here it is antigen presenting cells. It can be macrophage, B cells or Langerhans cells. So this cell is engulfing the bacteria, and then with the help of the T helper cells, it is influencing the B cells. Then the B cells will multiply, and then these multiplied B cells or the modified plasma cells, they will secrete antibody. And this antibody, when mediating a main immune response, it is called humoral immune response. So now we come to the structure of immunoglobulins. So here there are two terms. One is gamma globulin and immune globulin. So when we take a serum sample and do the electrophoresis, so here we take serum and then we perform electrophoresis. So there is one positive charge end, one negative charge end. So here we apply the serum. So after electrophoresis, it will be separated into albumin, alpha 1, alpha 2, beta and gamma globulins. So here mostly the immunoglobulins are gamma, but some of the antibodies can be alpha or beta, but majority are gamma. So now this is the structure. In any immunoglobulin, there are 4 polypeptide chain. This is one chain, this is another chain, this is another one, and this is another one. So the small ones, they are called light chains, and the long ones are heavy chains. So as in every amino acid, there is one amino terminal and another carboxy terminal. Similarly, in all the peptide chains, there is one amino terminal, one carboxy terminal. So these 4 chains, they are associated with each other with the disulfide linkage. So here we can see at the amino terminal, the antigen binds. So this part is called antigen binding site. And here in the light chain we can see there is a yellow part and a green part. Towards the antigen binding site, this part is called variable part. And towards the carboxy terminal, it is called the constant part. So in all the 4 chains, there is one variable portion and one constant portion. So here, in the variable portion, as it binds to the antigen, there are also some part called hypervariable portion. So it helps much firm association with the antigen. So here, where there are these disulfide linkages, this area called hinge region. There are 2 enzymes. One is papain and another is pepsin. So we have to know when this papain and pepsin enzyme acts on this immunoglobulin, there are either formation of 2 fragments or formation of 3 fragments. So if this immunoglobulin is cut here and here, then how many fragments will be produced? How many? 3. Because this will be one fragment, this will be another fragment, and this will be another fragment. So if this immunoglobulin or antibody is digested or cut here, how many fragments will be produced? 2 fragments, because all these fragments are connected by disulfide linkages, but this fragment is not. So here, when papain enzyme acts, it produces 3 fragments, and when pepsin acts, it produces 2 fragments. So here, as we have seen, there are 2 heavy chains and 2 light chains. Depending on the type of immunoglobulin, the number of amino acids in each of the chains can be different. So depending on the heavy chain, we classify immunoglobulin or antibody into 5 major classes. gamma, mu, alpha, delta and epsilon. And we have to remember that in any class there can be only kappa or lambda. So if it is IgG, it can only be IgG2 or gamma 2, kappa 2 or gamma 2, lambda 2. It cannot be 1 gamma or 1 kappa. So here the two regions, one is variable and another is constant. So the light chain also have a constant region and variable regions, and also the heavy chain also have a constant and variable regions. And depending on the type of the immunoglobulin, the number of amino acid can vary in the light chain and heavy chain. So here is the two enzyme. One is papain and another is pepsin. When papain acts on the immunoglobulin, it will produce 2-FAB fraction antibody. That is the antibody binding part. And another is FC. It is crystallizable fraction. And when the pepsin enzyme will act, it will produce 2-FAB and one crystallizable part. So here in this picture we can see papain enzyme is acting, 3 parts are produced. And here pepsin is acting and only 2 parts are produced. So here when this part is interacting with an antibody, and when this part is interacting with an antibody, so the antigen-antibody reaction, which will be more stronger? When this antibody part is interacting with the antigen, this will be more strong, or this part interacting with the antigen, this will be more strong. Why first one? Because these have 2 antigen binding sites. This fragment has 2 antigen binding sites, but this part have only 1. So which will be more stronger? Where there is, or where there are 2 parts. So this part more tightly attaches to antigen. Now we come to the different classes. So here we can see G, E and D. They generally exist as monomers. And IgM, this exists as pentamer. So in IgM, how many polypeptide chains will be there? Generally in a monomer, there are 4 polypeptide chains. So here how many polypeptide chains are there? 4. So here it is a pentamer. So how many polypeptide chains will be there? So you can just calculate. And IgA, it can exist either as monomer or a dimer. So here this pentamer is connected with each other with the help of a polypeptide chain. So this is called J chain. And here we can see in case of IgA, there is a J chain, and associated with this dimer is a green part. So this is called secretory part or secretory piece. So first we come to IgG. These have 2 2 heavy chain and 2 light chain. This is the major kind of antibody. About 80% of the total 80% of the total immunoglobulins. IgG is mainly found in secondary immune response, and it can pass from one vascular compartment to the other, and so it can also pass through the placenta. So it can pass from the mother to the fetus, and when the fetus acquires these immunoglobulins, this immunoglobulin stays in the fetus or the baby after birth for about 2 to 4 months. This IgG can be even classified or subclassified into 4 subclasses, and these subclasses are 90% similar in structure and mainly different in function. So these subclasses are similar in structure. So the 90% of the structural amino acids are the same, but the function is different. Now we come to IgM. It has 5 subunits. It is a macroglobulin. So there are 10 heavy chain and 10 light chain. So there are total 20 polypeptide chains. They are connected by J chain. So they cannot pass through the vascular space. Most of the blood group antibodies, they are natural antibodies, and they are IgM type. So here we can see these are the 5 subunits, and here they are connected with the J chain. As they have multiple antigen binding sites, so one IgG can connect with several bacteria, and this property helps in the production of agglutination. Now we come to IgA. IgA is also called secretory antibody. This IgA generally exists in the blood as monomer, but in the secretions it exists as dimer. So after they are secreted, they have another part associated with it called the secretory piece. And this part is produced in the liver, this secretory piece. So here we can see these are the epithelial cells. So these plasma cells are secreting IgA. They are getting attached on the epithelial cells with the help of poly-Ig receptor. They are internalized. There are some enzymatic modification within the epithelial cells, and when they are secreted into the lumen, suppose the lumen of the GI tract. So during the passage through the epithelial cells, they are acquiring this secretory component of the secretory piece, and when they are within the lumen of the GI tract, they have this secretory piece, and this secretory piece helps this IgA to escape digestion in the GI tract. So this IgA is mainly found in tears, saliva, GI tract, and milk. Now IgE, they are generally found in hypersensitivity reactions. Hypersensitivity reactions can be allergy or anaphylaxis. So the most important cells associated with IgE are the mast cells and basophils. So can anyone tell me what is allergy? It is hypersensitivity reaction, but in general sense, what is allergy? Whenever some antigen is entering our body, either they are producing IgG, IgM, or when it is producing IgE, so that antigen is allergic antigen, like the pollens. So many people have asthma. Asthma, what is asthma? It is a kind of hypersensitivity reaction, or it is a kind of exaggerated allergy. So these two cells, the mast cells and the basophils, they produce certain kind of chemicals that induces this allergy. One of the very important chemical produced by these cells is histamine. So that's why when any person feels they are having allergic reaction in their body, they take what kind of pills? Antihistaminics. So when a person is suffering from allergy, how can you know? Like what will happen to the person when he has allergy? Like how will he or she manifest? There will be redness. Inflammation you cannot see, that is redness. What you can see is redness. Then anti-allergic, I think almost all of you have taken at some point of time. So what will be the manifestation of allergy? So why will you take this antihistaminic or anti-allergic pills? Generally what happens when a person is having allergy? Running of nose, then increased lacrimation, redness of the skin, sneezing, and if it is much more allergic, then it will produce constriction of the respiratory tract. So what will be the manifestation? If there is constriction, asthma. So that is asthma. So all these are allergic. So what will be the main chemical interacting in allergy? That is histamine. So what are the cells? Important, mast cells and basophils. So when a person for the first time interact with the antigen or the antigen enters the body, so it will stimulate the what kinds of cells? So first the antibody will have to be produced, macrophages. The macrophages will interact with the B and T cells. So the B cells will produce antibody after getting converted to plasma cells. So the plasma cells are producing antibody. So this IgG will be produced, IgE. So this IgE will get attached on the surface of these mast cells or basophils. This is the first time when the antigen or the allergy producing antigen entering in our body. So when the person is having this antigen, allergy producing antigen for the second time, then the body already have these mast cells covered with this IgE. So the antigen will directly act on the antigen binding part of this IgE that is attached with the mast cells or the basophils. So then these basophils or the mast cells will release certain chemicals. Some are slow reacting chemicals, some are histamines, and there are several other interleukins, other chemicals. So then the allergic reaction will be produced. So many people have allergy to penicillin. So what are the other kinds of allergy? He or she can have hay fever. It is also a kind of allergy. Allergy due to fungus. Asthma by the pollens. Allergic reaction can be also due to helminthic infections. So these are the symptoms of the allergy. Sneezing, rash, runny nose, edema, cough, redness, lacrimation, headache. So here we can see for the first time when suppose this is a ragweed. So this is a antigen. It is entering the body. It is interacting with the B cells. So the B cells is producing plasma cells. These plasma cells will produce IgE antibody. So then this IgE will get attached on the surface of these mast cells. So this is the first time. And when the antigen is entering for the second time, they already have this IgE attached on the surface of these mast cells. So when the antigen is interacting with this antibody attached on the surface of these mast cells, they release chemicals. And these chemicals will produce all these symptoms. So the last one, IgD. The function of this IgD is generally not known, but they act as receptor on the surface of these B cells. Now we come to paraproteinemias. One is plasmacytoma or multiple myeloma. It is a kind of malignancy of the blood cells or the plasma cells. So what is the function of the plasma cells? To produce antibody. So what in general, what is cancer? Whenever a cell is multiplying at an uncontrolled rate, then it is cancer. So when more plasma cells will be produced in the blood, will there be more antibody or less antibody? So plasma cells are more, so antibody will be more or less? More. So antibody helps in immunity. So when there are more antibodies, the person will have more immunogenic property or less? I mean, the person's immunity will be more or less? Autoimmunity is different. In autoimmunity also, the antibody is produced. But these antibodies are not against some external antigen. It is against the antigen or the protein of the person's own body. So in this, when there is more plasma cells in multiple myeloma, there are more antibodies. So the person will have more immunity or less? What is the function of antibody? What is the function of antibody? ক্লাস শেষ হয়ে গেল, এখন অ্যান্টিবডি কি তাই জানো না? ঋত্বিক বলো। প্রোটিন that helps in the immunity. তাহলে অ্যান্টি, হ্যাঁ কমে যাবে, সেটাই তো বলছি। ওয়াই? সব কিছুর ওয়াই জানার দরকার নেই, কিন্তু এখানের কারণ আছে, তবে যেটার কারণ আছে সেটার কারণ জানতে হবে, তা না হলে পাস করা যাবে। They are cancer cells. So cancer cells lose their normal property. So when the normal property is lost, so the normal antibody will not be produced. So the antibody that is produced is abnormal. Although the amount is much higher, but the functionally they are not functional. So in multiple myeloma, when the serum protein is passed through electrophoresis, they will produce M band or monoclonal band. So here we can see, in the previous picture we have seen albumin, alpha 1, alpha 2, beta and gamma. But in the previous picture the gamma peak was up to here. But in this one the gamma peak is even higher than the albumin. So this is called M spike. So the number of plasma cells in the bone marrow will be much higher in multiple myeloma. There is also destruction of bones in multiple myeloma. These also have a reason. This is a fact that this happens, but this also have a reason. So there are mainly two kinds of cells in the bones, and they are in balance with each other. One is osteoblast, another is osteoclast. So what are the functions? What are their functions? Osteoblast helps in bone formation and osteoclast helps in bone resorption or degradation. So these multiple myeloma cells produces osteoclast activating factors. So the osteoclasts are much more active, and when the osteoclasts are much more active, there will be destruction of bone. There is also raised level of beta 2 microglobulins, and I have explained that the immunity is depressed. So here we can see in multiple myeloma, here there are much more plasma cells in the bone marrow. So these are the main four features of multiple myeloma. There will be anemia because the bone marrow has much more plasma cells, and so the number of red cells produced will be less. The bone is getting degraded, so the bone will release calcium. So one is the bone is becoming weak and there is high level of calcium, and these immunoglobulins which are produced in excess amount, they pass through the kidney, and after a certain period of time this excess calcium and this excess protein, they damage this kidney. So there will be kidney problem and kidney failure. So there is high calcium, kidney failure, anemia and bone problems. So now we come to Baines-Jones proteinuria. So this is huge amount of light chains that are produced in multiple myeloma are excreted in urine. This protein is called Baines-Jones protein. So what is its special property? It gets precipitated when heated between 45 to 60 degrees Celsius. And when it is heated higher than 80 degrees Celsius, it is redissolved. So this protein can block the kidneys and cause renal failure. and we can detect with the help of Bradshaw test. So this is heavy chain disease. It can be gamma chain disease. It can also be alpha chain disease. So in gamma chain disease, there can be hepatosplenomegaly or lymphadenopathy. In alpha chain disease, there can be abdominal lymphoma or malabsorption. And then we come to Waldenstrom's macroglobulinemia. So which one is macroglobulin? The pentamer, that is IgM. So IgM is increased. It is due to malignant proliferation of the IgM plasma cell clones. Males are more affected. And if there are increased amount of protein in the blood, the viscosity will increase. As there are more IgM, the viscosity will be increased. And this can be detected by Sears test. Okay, so immunoglobulin done.
That helps to regulate our temperature in day-to-day life, to control. Why it is important? Why temperature control is must? Whenever you are going to a desert, whether you is going to a very hot place, whether in European country during winter season or in our season also, January is very hot. But our core temperature is always kept normal. That the term is very important. I uttered just now, that is a core body temperature. That means somehow there are two parts of our temperature differentiations. One is a core temperature, one is core temperature, and another is our peripheral temperature, right? Another is our peripheral or skin temperature. আমি এখন দেখছি এটা হ্যাঁ ঠিক আছে, this is called কি core temperature, peripheral. Yes, please close the door. Thank you. So core temperature must be constant. If it is constant, that means some term will come, homeostasis. বুঝতে পারছিস এবার রিলেশন গুলো আসছে। Now temperature homeostasis, তোকে যদি বলা হয় যে how it is controlled, temperature homeostasis, who is the controller, where it is controlled, তাহলে temperature homeostasis টা দিলে ঘাবড়ে যাস না। Homeostasis mean temperature must be controlled at a constant level or a constant range. Our normal temperature is different, book a different country is different, and also different environment is different. So at least you remember that is in centigrade normally 36.6 to 37 centigrade, और একটা আছে 98.6 যেটা বলছিল 98.4 খারাপ বলেনি ডিগ্রি ফারেনহাইট। So these things are normal range থেকে এটা 2, this is range and this is in Fahrenheit. So this temperature is for the core temperature. Why core temperature is important? Anyone? Why? To keep our core temperature. Core temperature means key internal organs at a constant temperature. Heart, brain, kidney. কেন দরকার? Why? Anyone? Metabolism, enzyme. These terms are very important. That means our enzyme system is correcting our day-to-day life changes, and some metabolic system, metabolism, enzymatic activity, catalyzing. That means if it works at a fixed temperature, temperature is fixed. For the core temperature, that is 36.6 and 37 degrees centigrade or 98.6. যদি ভুলেও যাস 98.4 to 98.4 এই 6 ডিগ্রি ফারেনহাইট বলে দিবি। এগুলো ভাইবার কোশ্চেন হয়, থিওরিতেও আসতে পারে, তোদের যখন দিয়েছে তার মানে এটা তোদের আসতে পারে। দ্যাট মিনস এটা সিলেবাসে আছে, আমি জানতাম না। সো এনিহাউ This temperature regulations is mostly important for our core temperature. বারবার আমি এটা বারবার বলতে চাইছি কেন? Because this temperature at core area or our internal body or internal organs is important for to carry out our different reactions, enzymatic reactions, metabolism, metabolic rates, everything is dependent on this temperature. If any temperature is fall or increase, that will be deranged, and if it is deranged, then everything will be deranged. So temperature control is very much important. Who and how it helps? Who and how it helps to keep this temperature fixed point? কে করে? Hypothalamus. Very good. Hypothalamus controls our set point. বলেছিলাম যে hypothalamus বলেছিলাম set point করে। set pointটা কি জিনিস? এই যে আমার এখন জ্বর নেই, তোদেরও কারো নেই, হোপফুলি ঠান্ডা লাগছে না। So temperature is now at the 98.6 কি 98.7 কারো 98.4. That is a set point detected by my hypothalamus. Mainly hypothalamus three area is very important. One is preoptic area, another is a anterior hypothalamus, another is a posterior hypothalamus. Whenever you are dealing with temperature regulation or everything and related to the center that is related to hypothalamus, in the hypothalamus only remember the three sides. One is preoptic area, one is preoptic area, another is anterior hypothalamus, okay, and then it is a posterior hypothalamus. Now this hypothalamus keeps our set point. Biological clock যেমন পড়েছিস, that is how our set point is required, that is for the temperature at constant of our core temperature. Peripheral নিয়ে আমি তো চিন্তা ভাবনা করব না। How can you detect this core temperature? Any idea? No. Core temperature এইভাবে দেখা যায় না। No. হ্যাঁ দেখা যেতে পারে। সব থেকে ইজি হচ্ছে rectal temperature. Rectal temperature is the most appropriate core temperature detections. Peripheral temperature, axilla, এখানে দিচ্ছিস। টিম্পানিক মেমব্রেনটা এমনই একটা ডেলিকেট মেমব্রেন, আমি ওখানে তোকে কি করে বলি বলতে এখন দেখতে, তার জন্য তার সেট আপ দরকার, তার আলাদা থার্মোমিটার আছে। তাহলে ওইদিকে আমি যাবো না, তোকে আমি বলে দিলাম হ্যাঁ করা যাবে, তুই কানাতে খোঁচাচ্ছিস আমি করে। তাহলে ডক্টর মুখার্জি বলেছিল কানাতে খোঁচালে কোর টেম্পারেচার পাওয়া যায়, নিয়ে টিম্পানিক মেমব্রেনটা ড্যামেজ করলি। সেই জন্য আমি এমন কোনো টার্ম বা এমন কোনো কিছু তোদের এখন এই প্রাইমারি স্টেজে বলবো না যেটা দ্যাট উইল হার্ম ফর ইউ অ্যান্ড অলসো ফর ইউর ফ্যামিলি অ্যান্ড ইউর ফ্রেন্ডস অলসো। সো দ্যাটস ওয়াই ইউ আর গোয়িং টু বি এ ডক্টর, ইউ হ্যাভ টু বি এ হিউম্যান ডক্টর, নট এ পেট ডক্টর। ইচ অ্যান্ড এভরি স্টেপ ইজ ভেরি ইম্পর্টেন্ট টু সেভ দ্য লাইফ। বারবার বলছি এটা, এই জন্য বলছি পড়তে ইন্টারেস্ট পাবি। আমাকে সেভ করতে হবে তো, মানুষটাকে আমাকে সেভ করতে হবে, ইউ হ্যাভ টু সেভ। আর যদি ভালো না লাগে লিভ ইট, ছেড়ে দে। প্রচুর ভালো ভালো লাইন আছে। মোস্ট careless and non-intellectual line is the doctor line. Being a doctor for last 12 years after passing, I have my gut felt feeling is that not only doctor is the line. আমি আর বহু কিছু করতে পারতাম, তোরাও পারবি। মোস্ট কম্পিটেন্ট এখানে আছে যারা হয়তো ডাক্তারই ভালো করে করবে না, বাট আদার্স লাইন উইল বি ফর দ্যাট দারুণ জিনিস। কিন্তু বাবা মা বলেছে ডাক্তার হবে। If you really want, then come. Temperature control means core temperature, peripheral, rectal temperature, hypothalamus, preoptic area, anterior hypothalamus, posterior hypothalamus. আপাতত এইটুকু হয়েছে পড়া। core temperature, set point. এইটুকু এখন এসেছে আপাতত। Now, if you feel hot flash একটা হচ্ছে, আমার গরম লাগছে, ঠান্ডা লাগে, এবার আসবে জ্বর ভাব একটা আসবে, that means temperature is increasing, you're feeling. Temperature regulation always done by two process, that is heat productions or heat loss. Simple জিনিস। হোমিওস্ট্যাসিস করতে গেলে দুটো জিনিস দরকার, একটা হিট মানে প্রোডাকশনস, another is a heat loss. Heat production by some food stuff খেলে আমাদের BMR বাড়বে, জানিস তোরা। Basal metabolic rate will increase, number one. Number 2, some exercise করলে ইনক্রিজ করবে। তেমনি হিট লস, রেডিয়েশনস, কনভেকশন, আর কি আছে, কন্ডাকশনস। মোস্টলি হিট লস ইজ ডান, এটা এটা খেয়াল রাখিস, by 50% cases of heat loss is done by the radiation. Next is the evaporation. How? Sweat. When you are dealing with a sweat, that means stimulation of sweat gland, that means sweat is coming out to cool that local area. Latent heat, what is physics? So in this way, heat is mostly heat loss by the radiation. Next is the evaporation through sweat, then convection. Convection loss মানে কি? What do you mean by convection loss? Convection loss means some air's movement দরকার, airy movement. এয়ার বা উইন্ড ছাড়া কনভেকশনে কোনো রোল নেই টু হিট লস। যেন আমরা বলি, অনেক সময় বাচ্চাদের বলি যে যখন জ্বর আসবে ফ্যানের তলাতে ছেড়ে দাও জামা প্যান্ট খুলে, বিকজ দিস উইল হেল্প ফর দ্য রেডিয়েশন অলসো অ্যান্ড অলসো কনভেকশন অলসো, হিট লস করো। নাও why it is happening? Your set point is 98.6 or 37 degrees centigrade. Now you are telling that you are dealing with 102. Your temperature 102. What is happening here? কি জিনিসটা হচ্ছে? That means somehow the set point of hypothalamus have rise. কিভাবে হবে? যদি একটা কার্ভ আঁকি, এখানে মনে করো একটা কনস্ট্যান্ট একটা টেম্পারেচার, বডি টেম্পারেচার, আর এটা হচ্ছে আমার হাইপোথ্যালামাসের এই কাছাকাছি আঁকলাম, হাইপোথ্যালামাসের একটা সেট পয়েন্ট, আওয়ার বডি টেম্পারেচার, and this is the hypothalamic set point temperature, set point করেছে। সাপোজ দিস ইজ 98.4, দুটো একসঙ্গে যাচ্ছে। নাও you feel the temperature, you feel means এই সাদাটা বেড়ে গেল, feeling the 102. Suppose this is 102 degree Fahrenheit হয়ে গেছে। Body will cope up with that set point via the increasing the set point of the hypothalamus also. এও করে গেল সঙ্গে সঙ্গে, করতে হবে এটা, সেট পয়েন্টে নিয়ে আসতে হবে। নাও সাপোজ ইউ আর ডিলিং উইথ, তুই ছেড়ে দিলি কিছু খেলি না, বা তুই প্যারাসিটামল খেলি, অনেকক্ষণ রইলো কিছু খেলি না, মনে কর কিছু খেলি না, নো পেন কিলার, নো এনসেডস এটসেট্রা, it will also remain same. Naturally হচ্ছে কিন্তু এটা, after some time it may reappear in the same set point, and also this one will be in this way. That means I am telling this way that why our hypothalamic set point and our temperature goes parallelly. That's why we feel the temperature, but our core temperature tries to remain the same. কোর টেম্পারেচারকে বাড়াচ্ছে না, কিন্তু পেরিফেরাল টেম্পারেচারটাকে বাড়াচ্ছে। সেটা করছে কে না, হাইপোথ্যালামাস চেষ্টা করছে, হিজ ট্রাইং। নাও ফিভার, ফিভার কি কি ভাবে হতে পারে? ফিভার বল এনিওয়ান, ফিভার কি কি কজ হতে পারে? প্যাথোজেন্স, ব্যাকটেরিয়াল প্যাথোজেন্স, ফাঙ্গাল, ভাইরাল হতে পারে। নাও ফিভার প্রসিডিওরসে তিনটে জিনিস খুব ইম্পর্টেন্ট, 3 steps is very important to cause the fever or you acknowledge the fever. সেটা কি কি জিনিস? One is the cytokine release. Cytokines release. তাহলে cytokines number 1. Number 2, action of the cytokine into the hypothalamus with the production of prostaglandin E2. তাহলে এখানে PGE2. Number 3, increasing the cyclic AMP, it increasing the set point. বোঝা গেল? আবার বলছি, when you are feeling temperature, that means some infectious agent is there, that may not be always infectious, that may be non-infectious, like autoimmune disease, pathogen নেই তো, autoimmune disease, cancer, carcinoma, তাতেও আমার জ্বর আসতে পারে। এটা লিউকেমিয়া, একটা ব্লাড লিউকেমিয়ার বাচ্চা, কয়েকদিন আগে একটা ডায়াগনোস করলাম AML। তো দিস পেশেন্ট ইজ কামিং উইথ কমপ্লেন অফ ফিভার অনলি, লো গ্রেড ফিভার থাকে স্যার। But when you are dealing with tuberculosis, it is dengue, it is COVID, is pathogens, right? So these pathogens, when pathogen is there, then cytokine release will be there. কিভাবে করবে? immune system চলে যায়। When any pathogens is entering in your body, that means your phagocytic system will be activated. Neutrophil, macrophage, everything and immune cells will be activated. আমি তোদের একটা পয়েন্ট বলেছিলাম অনেকদিন আগে, আমার মনে আছে, যে whenever you are dealing with a high fever, that means our immune system is in topmost function. No, yes. So at the level of high peak of temperature, the immune system's ability to kill the offending agents is high. তাহলে আমি যদি এইখানেতে ওকে প্যারাসিটামলটা দিয়ে দিতাম PCM, তাহলে সে এইখান থেকে হয়ে এখানে চলে যেত, কি হতো? ইমিউন সিস্টেমকে সাপ্রেস করতাম। রিমেম্বার ইট, ইমিউন সিস্টেমকে সাপ্রেস করা যাবে না। তার মানে জ্বর হলেই আমাকে প্যারাসিটামল খেতে হবে, এই ফান্ডাটা কিন্তু ভুল। ইফ ইউ আর ফিলিং আনকমফোর্টেবল, ইউ আর ফিলিং টু মাচ চিল অ্যান্ড রাইগর, uncomfortable to eat, uncomfortable you are feeling somehow, you can take paracetamol in very low dose for a short period of time, not a strong ibuprofen, ibuprofen অনেকে খায়, হ্যাঁ জ্বর হয়, ঘাম দিয়ে একদম ছেড়ে যাবে, কেন আসছি, কেন করবে? Now these cytokines are very active proteins. এটা কি কি হতে পারে? পাইরোজেনিক হতে পারে, আবার অ্যান্টি পাইরোজেনিক হতে পারে। Pyro means heat, gens means generations. So pyrogens means different types of pyrogens means that causing the fever, that means heat. So one of the important cytokines that is important for raise your temperature is interleukins. কি interleukin 1 মনে রাখ, 6, 8, আর কি হতে পারে? ইন্টারফেরন গামা, আর কি হতে পারে? ম্যাক্রোফেজ, ইনফ্লেটরি প্রোটিন বিটা, মনে রাখার দরকার নেই অত। So these things are very much important, and within 3 interleukins, this one is most active and most potent cytokines is enough to form or formation of PGE2. That means আমাকে ফিভারের সেট পয়েন্ট ক্লিয়ার করতে গেলে PGE2 কে বাড়াতে হবে। PGE2 কে সেই বাড়াতে পারবে যে সাইটোকাইনস আসছে, and that cytokines will in the blood vessels, and remember these blood vessels does not mean that it crosses the blood brain barrier. সাইটোকাইনস কিন্তু ব্লাড ব্রেন ব্যারিয়ারকে ক্রস করবে না, কি করবে? ব্লাড দিয়ে গিয়ে ওই প্রিঅপটিক এরিয়া বলেছিলাম মনে আছে, হাইপোথ্যালামাসে, সেখানে প্রিঅপটিক ক্রেস্ট, there is a preoptic crest and that is fenestrated capillaries are there. মানে আমি একদম মানে হাইপোথ্যালামাসের ভিতরে ঢুকে গেছি। হাইপোথ্যালামাস, preoptic area, fenestrated capillaries, cytokines go to the preoptic area, then it stimulates the formations of PGE2 mostly. Prostaglandin অনেক কিছু হতে পারে, but mostly responsible for our fever or temperature high is the PGE2. After the formation of the prostaglandin E2, এটার একটা কারণ আছে, কারণ সাইটোকাইনস activates the phospholipases. If phospholipases enzymes are activated, then PGE2 formation will be easier. You know better than me in biochemistry. So if PGE2 formation, it increases the cyclic AMP level and increases the set point. এইটা কিভাবে এক্স্যাক্টলি করে এটার বোঝার উপায় এখন তোদের এই ক্লাসে নেই, তাহলে এই ক্লাস শেষ হয়ে যাবে। So remember always cytokines, PGE2 formation, cyclic AMP, set point. So when at our body is in set point, better to avoid to give paracetamol until unless you are comfortable, is uncomfortable. So interleukin 1 is a most potent cytokines to cause the release of PGE2 and increase cyclic AMP level and set point increasing on 6 and 8. Another cytokines is there that is anti-pyrogenic. Do you know anyone? That is the interleukin 10. It is an antipyretic. Anti there. কি কি গ্লুকোকর্টিকয়েডস, জানি স্টেরয়েড খেলে আমার টেম্পারেচার ইয়ে হবে। আলফা মেলানোসাইট স্টিমুলেটিং হরমোন, আলফা এমএসএইচ, নামগুলো লিখি তো ভ্যাকেন্ট লুকে সব তাকিয়ে আছিস, ভ্যাকেন্ট লুকে তাকিয়ে আছিস, কোথায় লিখবো? আচ্ছা এখানেই লিখি। সো অ্যান্টি পাইরেটিক, কিছু কিছু মনে রাখ, জিজ্ঞেস করলে জিজ্ঞেস করতে পারে, ভালো বলতে পারলে। ইন্টারলিউকিন 10 যেমন 168 হচ্ছে এরা পাইরোজেন্স, এরা হচ্ছে অ্যান্টি পাইরোজেন্স। এটা হচ্ছে ইন্টারলিউকিন 10 only cytokines that is only acts as a anti of fever, exception case. Now AVP কি জিনিস সেটা? আর্জিনিন ভেসোপ্রেসিন। দেন কি বললাম একটা আলফা এমএসএইচ, গ্লুকোকর্টিকয়েড। These are the antipyrogens or antipyretics. মনে রাখার যে বিশাল দরকার আছে তা নেই, বাট ওটা জেনে রাখ যে এরকম সাবস্টেন্স আমাদের বডিতে আছে to some extent causing the antipyretic and pyrogens inhibitory করে actions, and some are there like interleukin 168, macrophage inhibitory protein beta, interferon gamma, and also tumor necrosis factor alpha. এই টিউমার নেক্রোসিস ফ্যাক্টর আলফার একটা বৈশিষ্ট্য আছে, কি জিনিস? দিস টিউমার নেক্রোসিস ফ্যাক্টর আলফা মানে টিএনএফ আলফা, টিএনএফ আলফা, টিএনএফ alpha is both acts as pyrogens and antipyrogens. So these things are very much important. Whenever concentration of TNF alpha is high, that will goes dominance towards the temperature high, and if it is temperature is low, concentration is low, it acts as a antipyrogens. It is written in different journals, but I know that this is the only chemical component of protein that is both actions are there, antipyrogens and pyrogens. So up to this কি কি হলো? Core temperature, to maintain our core temperature homeostasis, that means our metabolic system and enzymatic system, enzymatic reactions must be in the homeostasis position so that our metabolism will be in constant phase. Number one. Number two, it is dependent on the center, that is the hypothalamus, mainly the three areas, that is a preoptic, anterior hypothalamus, posterior hypothalamus, and it depends upon the set point, the temperature controlled by the set point done by the three process, that is the cytokine release whenever it is infects us, whenever it is not infects us, যদি autoimmune disease হয়, in that case only somehow some inflammation is there, that may not be some infecting agents, but that autoimmune diseases means some inflammation must be there. If inflammation must be there, that means the cytokines release as a whole, not from an agent. কোনো phagocytes থেকে না বেরোলেও তারা cytokines release করবে, it acts to productions of the increasing the activity of the phospholipases, it will increase the PG prostaglandin E2 and increase cyclic MP level to increase the set point. So temperature or fever is not a disease, it is on a symptom of a disease, right? And temperature does not mean that you have to stop this, because at the level of peak temperature your immune system is in peak level. Whenever your COVID vaccines, COVID infections is there 101, 104, আমার মাইরি ছিল 104, rarely I applied the paracetamol because I know the physiology behind the fever, and that's why immune system is fast to cope up the cytokine storm. In that case, if it is more than cytokine storm, then body response or immune system is weak for that fellow or any person, then we are apply for the steroid, that is the glucocorticoids. Already told you that is the mainstay treatment was in the COVID infections, right? So these things are interrelated in day-to-day life. Whenever you are dealing with the patient, will not only you give paracetamol, no, you can tell if you are uncomfortable at the level of more than 102 degree Fahrenheit, then only you apply for the paracetamol SOS basis, not the fixed hourly 4 hourly in that case. কিন্তু আমাদের সত্যিকারে বলতে গেলে কিছু পেশেন্টকে দিতে হয়, নইলে এই ফোন বাজতেই থাকবে। They are ringing and WhatsApp message, videos, everything is there. জ্বর কমছে না স্যার, জ্বর কমছে না। I know জ্বর কমবে না, it will stay in the baseline level and then it will pick up, এই যে বাড়ছে, whenever it is increasing, immune system is high and the offending agent is destroyed. এরকম বহু পেশেন্ট পেয়েছি যারা পেশেন্স ধৈর্যশীল, পেশেন্স আছে. Believe me, 95% patients of child fever is cured without giving any paracetamol and any treatment, only the hydration, because most fevers are mostly viral. In case of viral fever, it is at least 5 to 6 days. Now also some extent telling that is 7 days also, you can wait. If not, focus. If multi-organ involvement, কেউ বলছে গলা ব্যথা, পেটে ব্যথা, পায়ে ব্যথা, মাসল ব্যথা, that means multiple levels in increasing, that means focus is not there, that means mostly viral, but কেউ বলে না এখানে একটা abscess হয়ে গেছে. These are coming with the swelling and these abscess and tendon is there, tonsillitis, এটা focus, কান থেকে pus is coming out, ASM, that means focus is there, that means must be some bacterial cause is there. But remember this, 95% cases fever without any focus generally is mostly viral fever. So fever treatment is good or bad? My question is next is, fever treatment is good or bad? It is definitely bad, not good for the all time and not bad all the time. It depends upon the situations, it depends upon the causative factors, it depends upon the general conditions of the patient, right? So up to these cytokines, antipyrogens, interleukin 1, 6, 8, interleukin 10 is the antipyrogens, alpha MSH, at least you can sell the glucocorticoids, you remember this, and interleukin 10 as the antipyrogens, at least 2. And interleukins helps in the tumor necrosis factor alpha, it acts in both directions, but it also very much important potent pyrogens or cytokines like interleukin 1. এটাও কিন্তু একটা protein. So now, so temperature is not a bad thing. তাহলে বাড়ির লোকেরা যখন টেম্পারেচার বলবে, give them assurance that if you are feeling temperature, that means your body is fighting. Your body is fighting. Your neutrophil is coming to act. Your neutrophil releasing the cytokines. That cytokines is giving the prostaglandin formations. Cyclic AMP increasing and set point is increasing, and at the level of set point, our immune system at the peak level to kill the offending agent by its own process. That means fever itself, immunity, innate and adaptive, both immunity are activated by the fever. Remember. So fever activates innate and adaptive immunity. এটা পড়ছিলাম তো, হ্যাঁ? So innate and adaptive immunity, that means specific and non-specific immunity is activated by the fever. So anyhow fever suppress করাটা কোনো ক্রেডিটের কাজ নয়, এটা কোয়াকের কাজ. So don't be a quack. Okay? Be a clinician and a good clinician and step by step approach. Now, কি আছে তোদের আর? টেম্পারেচার, টেম্পারেচার রেগুলেশন আর কি আছে? তাহলে হাইপোথ্যালামাস গেল, পোস্টেরিয়র হাইপোথ্যালামাস, অ্যান্টি হাইপোথ্যালামাস, and then how it is balanced, এটা একটু বলে দিই. Whenever you are feeling fever, right? You are feeling fever. Suppose তুই আজকে বাড়ি গেলেই জ্বর আসছে. আমরা কি করি? আমরা ভুল করি সব. কিরকম করি? আমরা যেটা করি, আমরা হচ্ছি ঢাকা ফাঁকা দিলাম, ফ্যান বন্ধ করলাম, একটা প্যারাসিটামল খেয়ে নিলাম, সব অ্যান্টি কাজগুলো করলাম. কেন? না, whenever your great heat is there, most heat is there, that means we have to heat loss. ব্যালেন্স করতে হবে আমরা. হিট প্রোডাকশন বেশি হয়েছে, হিট লস করতে হবে. ব্যালেন্সিং ইজ ডান বাই, এই পিকচারটা মনে রাখিস. One is, কথা বলছি, heat productions and another heat loss. আমার ব্যালেন্স আছে, তাই আমি এখন ঠিক আছি. Anything, any disbalance, body will work. Body will tell you to do balance. কিভাবে করবে? টেম্পারেচার বেড়ে গেছে, তাহলে হিট প্রোডাকশন বেড়ে গেছে, তাহলে এটা এইদিকে ঝুঁকে গেল. তো কি করতে হবে? এটা ব্যালেন্স করতে গেলে আমাকে হিট লসটাকে বাড়াতে হবে. And heat loss is done 50% cases is mostly by radiations. তাহলে আমি যদি জামা কাপড় পরে থাকি বা একদম চাদর ফাদর নিয়ে সব করে দিলাম, জামা কাপড় তো পরে থাকতেই পারিস, কিন্তু চাদরটা আমি যেন খুলে রাখি. Okay, in that case is causing that heat loss is by the first of all radiations, then the evaporation, and then convection, conductions. Easy. Now what about the vasoconstriction? What about the vasodilatations? কি হবে? হাত পা ঠান্ডা হয়ে যায় কেন? কেন হচ্ছে? কনস্ট্রিকশন কেন হচ্ছে? To maintain the core temperature, all the blood vessels constricted in the peripherally to increase the vessel, যাতে ব্লাড আবার ইন্টারনাল অর্গানসে যায় বেশি। তাহলে আমার কাছে অনেক পেশেন্টরা আসে, হাত পা সব ঠান্ডা হয়ে গেছে, ঠান্ডা মানে ভাবে তা মরে গেছে, হাত পা ঠান্ডা হয়ে তো হবে, হাত পা ঠান্ডা হবে। In that case, we can assure that in case of adult, sometimes we use ice also, because if it is 105, temperature 104 পর্যন্ত থার্মোস্ট্যাট হিসাবে সেট পয়েন্ট কারেকশন করতে পারে হাইপোথ্যালামাস। রিমেম্বার, আপ টু, এটা একটু তর্ক বিতর্ক আছে, 101, 104 Fahrenheit to 105 degree Fahrenheit, in this range only the hypothalamus works for the set point, তারপরেতে যা হচ্ছে এর আর কোনো অ্যাকশন নেই। In that period patient may come with you with convulsion, internal hemorrhage, intracranial hemorrhage, confusion, delirium, coma. In that patients we use to cool the temperature by outside to decrease the level of that point so that hypothalamus acts. Because hypothalamus not only increase the set point, is also stimulate whether it must be their vasoconstriction করতে হবে, কি vasodilatation করতে হবে, কি radiations করতে হবে, that will help. Helps by the hypothalamus. How? Receptor. কি receptor? Two types of receptor. At a peripheral skin receptors, Ruffini ending, পড়েছিস এটা? কি একটা কি ক্রাউজ বাল্বস নার্ভ এন্ডিংস আছে না? আছে তো এখানে। কি করে রুফিনি এন্ডিংস বোধহয় হট, হ্যাঁ তাই তো, ঠান্ডাটা কে করে? হ্যাঁ মার্কেলস, হ্যাঁ দেখিস তো এগুলো, একটু দেখিস এগুলো জিজ্ঞেস করে, কিন্তু আমার এখন মনে নেই, তবে রুফিনি হট, এটা মনে রেখেছিলাম এইভাবে, রুফিনি যেদু যেদু রুটি গরম, আমার মনে আছে, ওইটা এমবিবিএস ক্লাসে মনে রেখেছি, ঠিক আছে। সো ঠান্ডাটাও কি এটা মনে রেখেছিলাম, মনে নেই ওটা, বাট রুফিনি ইজ হট। রুফিনি এন্ডিংস, নার্ভ এন্ডিংস, সেন্সারি স্টিমুলেশনস করে দ্যাট উইল গো প্রিঅপটিক এরিয়া, মনে আছে, anterior hypothalamus, posterior hypothalamus, sensation, and efferent output will come as a vasoconstriction, sweating, sweat gland, sweat gland করবে কেন? আমি যদি প্যারাসিটামল খেয়ে নিই বা কিছু খেলাম না, খানিকক্ষণ পরে আমার জ্বর ঘাম দিয়ে ছাড়ে, বলিস না অনেকে আমার ঘাম দিয়ে জ্বর ছাড়লো, কেন কেন হচ্ছে? দ্যাট ইজ হ্যাপেনিং ডিউ টু দ্য সেট পয়েন্ট চেঞ্জেস। সেট পয়েন্ট চেঞ্জ করতেই হবে টু মেনটেন দ্য কোর টেম্পারেচার, and that's why sweating is there, and that's why sweating is helpful for the relief or some evaporation that is under the radiation. After the radiation, evaporation is the main cause of heat loss. Now, if you are in staying intensive, going in intensive, some of you may chance your PLAB or FRCS or your PLAB exam clear, and then going to the England, it is a very winter season, then some cold injury you can came across. Cold injury you can came across. What are those? কি কি cold injury তোদের আছে দেখলাম, cold injury. Cold injury very rare in our country. Cold injury is very much important for the foreign country whenever the temperature is 0, nearby 0, -12, -13, there Canada, England, Scotland, Toronto. In these cases is too much, -20, -21, -14, -16 এরকম হয়, আমার নিজের বোন থাকে ওখানে। So we know that how it is chill blends and the cold injury হবে, কি হবে মনে রাখিস, cold injury short note দেয়। Cold injury means, keep your mind at least 4 terms. One is a chill bends. Number 2 parneo, এইসব নাম বল। Then frost bite, এটা তো শুনেছিস নিশ্চয়ই। Number 4 is a trench foot, TRENCH, trench foot. Trench footer একটা নাম আছে, নন ফ্রিজিং কোল্ড ইনজুরি। চচ্চর করে সব মনে পড়ছে আমার। So chilblains, পার্নিও, ফ্রস্টবাইট, ট্রেঞ্চ ফুট, চারটে কোল্ড ইঞ্জুরি হয় আমাদের দেশে, ভেরি রেয়ারেস্ট। কোথায় আমাদের ঠান্ডা কোথায় হতো শুনেছিস কারো কোল্ড ইঞ্জুরি? শুনলে বলিস। আমাদের এখানে কোথায় কাশ্মীর টাশ্মীরে হতে পারে, কিন্তু কাশ্মীরে হতে পারে অন্তত। চিলব্লেন্স এন্ড পার্নিও ইজ বেসিক্যালি এ মাইল্ড ফর্ম অফ ইঞ্জুরি। কি জিনিসটা হবে? রেড স্পট ইন টোজ, টোজে একটা করে দুটো করে রেড স্পট আসবে, ইচিং হবে, টেন্ডার হবে, সেন্সেশন লস্ট হতে পারে। দ্যাট ইজ এ মাইল্ড ফর্ম। ফ্রস্ট বাইট, ডেঞ্জারাস এন্ড সিভিয়ার। হাউ? Chilblains and pernio occurs mainly few hours you are staying outside, and then come to the frostbite in longer period of time, that in march korche kono ekta soldier ache guard, frostbite hote pare. Frostbite means ki hobe they are using layers socks, sweating ta jei hobe oটা ফ্রিজ হবে, বুঝতে পারছিস? সোয়েটিং হলো ওটা ফ্রিজ হলো, আবার ঠান্ডাতেই থাকলো। That means some frozen area, frostbite, ekdom obostha kharab. There is no sensation, there is painful, color changes, everything. Trench foot, non-freezing cold injury. Freeze hocche na, damp area. কি জিনিস? বরফ দিয়ে হাঁটছিস, বরফ দিয়ে হাঁটতে হাঁটতে বরফে যে আইস যে ইয়েগুলো ছোট ছোট যে টুকরো যেগুলো বলা হয় সেগুলো জুতোর ভিতরে ঢুকলো, সেটা জল হয়ে গেল, ড্যাম তৈরি হলো। That causing the trench foot. That is non-freezing, freezing হবে না, তাও cold injury হবে। Cold injury means some red spots will be there. Non-freezing cold injury, CINF, trench foot বলা হয়। তোদের শর্ট নোট দিতেই পারে একটা ট্রেঞ্চ ফুট লিখে দিলেই আর অপসল হয়ে যাবে আর কি। So in that case these are the phenomena. One of the important phenomena in our country also seen, that is the Raynaud's phenomena. Raynaud's phenomena is seen in many diseases. I am not going to this that way, but Raynaud's phenomena means একটা আঙুল সাদা, একটা পিঙ্ক, আবার একটা সাদা। Why? There is a vasoconstrictions. হাত দেখালো, এটা লাল, এটা সাদা, মানে এটা লাল বলতে এটা these are blood flow is going on normal, but here blood flow, there is no blood flow, and that causing the Raynaud's phenomena. Raynaud's phenomena is happening in India also in some extent, and it will self-limiting. But what is the treatment? What is the treatment of your chilblain and pernio? It is the treatment is simple. কি জিনিস? আমার যদি মনে হয় তাহলে আমি hot bag, but in case of frostbite, rapid heating or rapid warming is contraindicated. Slow by slow. Last two in case of emergency হবে, emergency room professionals, it must be treated by professionals. And children's pernio is very much common in America, in England, in winter season, and so that only the heating, temperature control at home and inside the home by regulating. ইংল্যান্ডে বা আমেরিকাতে বা কানাডাতে সব রুমের টেম্পারেচার রেগুলেটর থাকে। সো ইন দ্যাট কেস কোল্ড ইনজুরি, আর কি বলবো, কেউ কিছু বলবি তোরা? তো চিলব্লেন্স, পার্নিও, ট্রেঞ্চ ফুট, ফ্রস্টবাইট জানা উচিত। আর কি আছে তোদের? আচ্ছা, টেম্পারেচার যে ফিভার, হোয়াই আই আর ইউজিং অ্যাসপিরিন, why we are using NSAIDs? Do you know, heard the term NSAIDs? Anyone? ঠিক, non-steroidal anti-inflammatory drugs. হ্যাঁ, আমি বলেছিলাম, বাহ বিশাল ব্যাপার। So NSAIDs and paracetamol, aspirin, ফিভারে দিই কেন আমরা? Yes, কে বললি? Yes, that is the important. It inhibits the prostaglandin E2, and already you know cytokines PGE2, cyclic AMP set point. So set point কে চেঞ্জ করতে গেলে বা PGE2 যদি আমি কম করে দিই, then temperature will automatically set point এর নিচে চলে আসবে। So PGE2 is antagonist. Any antagonist against PGE2 is helpful for the fever control. Cold injury হয়ে গেল, now is the heat stroke হতে পারে আমাদের দেশে, হয়ও ইনফ্যাক্ট। হিট স্ট্রোক কি জিনিস? এটা হিট স্ট্রোক কি জিনিস? হাউ ক্যান ইউ কেম অ্যাক্রস ইন এ হিট স্ট্রোক পেশেন্টস? কিভাবে বুঝবে এটা হিট স্ট্রোক? এখানেই পেতে পারিস, ওপিডিতেই পেতে পারিস, এত গ্রামে গ্রামে গঞ্জে সব ঘুরে বেড়াচ্ছে, ফার্মার পেতে পারিস। They may come with early stage, middle stage or late stage. Early stage কি আসবে? Profuse sweating, some thirsty, thirst center stimulated, muscle cramp, heart rate is high, but he is conscious. Middle, to some extent confusion, sweating decreasing, lethargic, vomiting, abdominal pain. Last stage, comatose, unconscious, heart rate high, BP low, severe dehydration, pulse volume 3D pulse. Okay, to some, these are staging of heat. Can have exertions. So, heat stroke is divided into two parts. One is exertional heat stroke, another is a non-exertional. কি জিনিস? আমি রোদের মধ্যে দিয়ে কোনোদিন করিনি, ছুটতে ছুটতে বেরিয়ে গেলাম, গোটা বড় বুল ঘুরে বেড়াবো, ডেফিনেটলি আমার হিট স্ট্রোক হবে। রোদে একদম 42 ডিগ্রিতে কোনো অভ্যাস নেই, আই এম নট অ্যাথলেট, কোনো আমার অ্যাডাপ্টেশন নেই, কিচ্ছু নেই, আমি ছুটতে ছুটতে বেরিয়ে গেলাম, তাহলে ইজ এক্সারশনাল হিট স্ট্রোক। নন এক্সারশনাল হিট স্ট্রোক, গাছের তলাতে বসে আছে সে, এত হিটে 50-52 পুরুলিয়া সাইডে মাঠে কোথাও কোনো জল নেই, জল খায়নি অনেকক্ষণ, কাজকর্ম করে এসে বসে, তাদেরই তো হয়। So they are now in heat waves. Waves are coming. Exertion is not there, but heat is going increasing and increasing and increasing, and our body temperature, core temperature, trying again and again, but failed. Ultimately thermostat fail. ফ্রিজে দেখেছিস থার্মোস্ট্যাট থেকে ঘোরাতে হয়, আমাদের বডিতে হাইপোথ্যালামাস ঘোরাতে হয়, ওই কাপটা মনে রাখবি, উঁচুতে যায় নিচে নামে প্লেন হয়। So thermostat level is worked at a particular period and particular range. If it is more than 104, 105, malignant hyperthermia, that means hyperthermia is going on, and so hypothalamus failed, and so presentation will be like heat stroke. কি হবে আসবে? Dehydration, heart rate high, respiration high, ডগরা করে না করছে, হ্যাঁ, সো hyperventilation, যে ভাব এগুলো ভাবতে থাক, পেশেন্ট দেখবি তো তখন তো চিন্তা হবে। সো hyperventilation, fatigue, cramp, বোঝা পায়ে প্রচন্ড ব্যথা, ডিহাইড্রেশন হয়ে গেছে, সোডিয়াম পটাশিয়াম লস। তাহলে আমি যদি কনফিউশনে থাকি কোনো সময়, আমি একটা ব্লাড নিয়ে, একটা এবিজি, একটা ব্লাড নিয়ে সোডিয়াম পটাশিয়াম অ্যান্ড একটা ব্লাড গ্লাস অ্যানালিসিস করে আমি অ্যানালিস করে দেবো যে whether patient is suffering from any other metabolic problems or any other electrolyte disbalance, because fluid is a choice, cooling is a choice. Now এবার হিট স্ট্রোকে তুই আচ্ছা করে বরফের মধ্যে ঢুকিয়ে দিলি, তাহলে সে মরে, অ্যাডাপ্টেশন হলো না। সো ফার্স্ট অফ অল, primary stage and middle stage we can treat as a iceberg in two areas. What are those? That is the neck and the axilla is an important site to decrease the set point level of hypothalamus. One is the nape of neck, another is axilla. Remember this, ice pack neya holo, দিয়ে দেওয়া হলো, ভাই তুমি খানিকক্ষণ বসো, then you can offer you the ORS water, plain water, step by step and slowly. But if it is comatose, delirium, unconscious patients, conscious জানি না কি হয়েছে, কোথায় পড়েছিল কি ছিল, then only the slow cooling process is advised. Slow cooling process কেন না, পুরো রেগুলেটরি সিস্টেম, পুরো সিম্প্যাথেটিক সিস্টেম আমার ডিরেঞ্জড হয়ে আছে। In that case only we can assess the other parameters like electrolytes, like blood gas analysis, ABG, we can do that. But before that, if patient is suffering from dehydration, always charge a fluid at least NS. কিছু বুঝবো না, নরমাল স্যালাইন চালাবো। Okay, so this fluid will helpful for take a blood. কারণ একটা patient is coming with dehydration, you can't gain access into the vein, vein access করতে পারবি না, এটা আমরা বহুবার পাই। আর পেশেন্ট ডিহাইড্রেশন, কোথায় ভেন, কোথায় চালাবি, কি চালাবি? সো ইন দ্যাট কেস ইফ ইট ইজ ফ্লুইড ইনটেক, যদি কমাটোস থাকে, তোমাকে এনি হাউ ভেন্স ইজ নট অ্যাভেলেবল, দেন বোন ম্যারো পাংচার, দেন ফ্লুইড করা যায়। হিট স্ট্রোক পেশেন্টস ইজ মে কাম উইথ টু ওয়েজ, দ্যাট ইজ এক্সারশনাল হিট স্ট্রোক অ্যান্ড নন এক্সারশনাল হিট স্ট্রোক। করবি এগুলো, হাইপারথার্মিয়া, ম্যালিগন্যান্ট হাইপারথার্মিয়া পড়ে আসবি, রাইট? ম্যালিগন্যান্ট হাইপারথার্মিয়া শর্ট নোট দেয়, পার্নিও শর্ট নোট আসতে পারে, ট্রেঞ্চ ফুড শর্ট নোট আসতে পারে। ওকে, রেগুলেশন কন্ট্রোল, হাইপোথ্যালামাস সেট পয়েন্ট, রেগুলেটরি সেন্টার কোশ্চেন আসতে পারে। যেগুলো এসছে যখন তখন এই কোশ্চেনের বাইরে কিছু আসবে না। বাকি বল, কারো কোনো অসুবিধা থাকলে বল, আর কিছু মনে পড়ছে না আমার। Any questions from anyone? Bolo. So, take home message from this class is whenever you are dealing with a fever, that means our core temperature is constant by the help of hypothalamus. And also, fever is due to maybe due to the infectious agent, maybe due to the non-infectious cause. In case of infectious cause, cytokines will upper hand, mainly the interleukin 1, maybe interleukin 6, maybe interleukin 8. But cytokines release means this activates or stimulates formations of the PGE2 by the activating phospholipases. কোথায়? Preoptic area, anterior hypothalamus, posterior hypothalamus. Anterior hypothalamus is for the heat, posterior hypothalamus is controlled by the cold. জিজ্ঞেস করে এটা। Preoptic area টা কি জিনিস? Is why it is important? Because cytokine does not cross the blood-brain barrier. That's why it enters into the fenestrated capillaries in the preoptic crest, from where cytokines enter into the hypothalamus tissues, and then is formations of the PGE2 by the activating the phospholipase A2. A phospholipases. You guys don't know they were A2 ki B2. This phospholipase is a general term. It increases the PGE2 level, and this PGE2 increase level increases the cyclic MP to increase the set point of the hypothalamus. So, temperature monitoring or temperature treatment or fever treatment initial stage is bad, because at the high peak of temperature our immune system at the peak level, and in that level the offending agents may be killed by our immune system, like phagocytosis, like adaptive immunity, by our non-specific immunity, innate immunity. It is helpful for a temperature. So whenever you are uncomfortable, you can use, definitely you can use. Remember always, if any patient suffering from some cancer, the constant level of temperature is there, constant level of temperature. This is a non-infectious, but patient is comfortable. Patient is comfortable due to some pyrogens. Not only cytokines are pyrogens, pyrogens are different. বললাম macrophage infiltratory protein, ওটা তো cytokines নয়. So that does not release from the pyrogens or some pathogens. It's maybe due to some cancer, that may be some chronic disease, autoimmune disease, maybe some fever, maybe hypothalamic tumor also there. আমি একটা পেশেন্ট কেম অ্যাক্রস হয়েছিলাম, টেম্পারেচার স্যার বেড়ে থাকে, সোয়েট হয় না বাচ্চার। Ultimately we diagnosed by MRI that is the hypothalamus tumor is there. So hypothalamic tumor constant level is 101, 102 আছে। আচ্ছা ঠিক আছে, জল খাই থাকে, ঠিক আছে। That means ওর ওই টিস্যু কোনো কাজ করে না, থার্মোস্টেটের কোনো ব্যাপার নেই। টেম্পারেচার whenever this patient whenever outside hot is there is no role of any hypothalamus. আমি এখন বাইরে যাব, রোদটা খাবো, আমার কিন্তু পেরিফেরাল স্কিন রিসেপ্টর কিন্তু নেবে, ওই যে রুফিনি এন্ডিক্স নেবে, সেন্সেশন, দ্যাট উইল সেন্স। কি সেন্স করবে? ভাই তুমি কিছু সোয়েট করে দাও, দেখে নিবি না না সুপারফিশিয়ালি দেখে নিবি, ওগুলো ওটা পুরোটাই দেখে নিবি। কিটা ডিপ তো, হ্যাঁ এনি হাও তোর আলটিমেটলি তো ডারমার দিয়ে যাবে, এটা হিট তো, সেটা কোর টেম্পারেচার তোমার আছেই। ইন দ্যাট কেস সেন্সারি গোস টু দ্য হাইপোথ্যালামাস টু দ্য রিসেট পয়েন্ট, কি করবে? সোয়েটিং করে দাও। তাই আমি একটু এই যে ঘামছি, আমি ঘামছি কেন? আমার টেম্পারেচার পড়াতে হাই হয়েছে। সো উই আর সোয়েটিং ফর দ্য ইভাপোরেশন each and every step, but in that patients with hypothalamic tumor, there is no role of hypothalamus. Their constant level of temperature is increasing at the level of at a certain range. So core temperature must be constant to temperature homeostasis. Okay, thank you very much. Dismiss my class.
Whether you will be healthy or not, it depends upon so many factors. These are called the determinants of health. Mainly, right now, if we discuss different factors, the first factor that will come in your mind, that is lifestyle. That is lifestyle. Health also means it's a process of enabling people to to gain control about the determinants of health and improve them. That means the way through which we can be able to control the determinant, then control the factors that influence our health. That means to control the factors which determine whether you will be healthy or not. Okay? Now, in order to promote our health, usually different types of activities. What type of activities? Usually two types of activities we used to undertake. One is emotional activities, and at the same time, in case of critical cases, in case of complicated cases, we use counseling as a method of activity for promotion of health. So today I will discuss the different methods that we have used, all of you have to use to promote our health. So let's see what are the different types of health promotional activities usually we undertake. The first one, the first slide indicates that promoting health for adults. What type of activities? Number one, helping people to quit smoking. Say for example, adults are smokers. Okay. Now, if they feel that yes, now the time has come to quit smoking, but they are not able to quit the smoking. So, as a healthcare provider or as a doctor, we have to help the smokers how they can quit smoking. This is one of the health promotional activities. I will tell you one by one the different methods through which we can help people to quit smoking. Next one is increasing access to healthy foods and regular physical activity and its usefulness. That means people may know or people now know what are the physical activities and what type of foods they should. At the same time, they do not take or consume this healthy food. Instead of that, they used to take junk food, fast food. Okay. So, what type of health promotional activities? What are the methods that we use? Next one is preventing excessive use of alcohol. Okay. So, if we want to help people to prevent themselves for excessive use of alcohol, we require to undertake health promotional activities. Then, promoting undesirable lifestyle change and disease management. What happens, you see, nowadays, what we are accustomed to live a type of lifestyle is very difficult to change. But you see, through health promotional activities, we can help people, we can help the individual, we can help the group so that they can abstain themselves from that type of lifestyle and try to incorporate themselves or accustomed to practice different types of lifestyles. Next is promoting women's reproductive health. Next, promoting safe community water supply. People may not think about the importance of water supplies. This is very important to prevent many more diseases, especially all the waterborne diseases. For that disease, we have may undertake different types of health promotional activities. Promoting mental health and emotional well-being. That is again very important. Nowadays, you are thinking that yes, so many people are being depressed. They are suffering from depressive diseases. So, to help them, we should undertake different types of health promotional as well as counseling activities. Reducing anxious feeling. Always, many people always anxious. What will happen in your future? What you will do? We do not know in future. So, in order to help people to release or to reduce their anxious feelings, many types of health promotional activities may undertaken. Then exploring team dynamics, seeing and celebrating the best in others. Next one is correcting negative thinking. That is again very important issue. Always negative. No, I cannot do anything else. Nothing will happen. Okay? But yes, be positive always. So there are some ways and means. There are some health promotional activities. If you undertake these activities, if you can engage the clients or the people who used to think negative, always negative thinking, then they can try to become positive. Building trust among the people, analyzing the consequences of anger. Many times we become angry, but while we become angry, we do not think what are the consequences. So if you take health promotional activities or counseling activities, then we can think why we are becoming angry. If we become angry, what will happen? That means our positive thinking we cannot do. That's why we used to take different types of health promotional activities. Now, to undertake any type of health promotional activities, different types of approaches, different types of methods, as well as different types of materials we have to use. Then only health promotional activities will be fruitful. Effective health promotional and educational interventions require right approaches, right methods, right materials, and right channels. That you have to know what are the different methods that you have to use while dealing with the people. For what type of promotional, health promotional activities, what type of approaches, what type of methods, what type of materials you have to use. Perhaps you know that there are three types of approaches to deal with human being. One is individual approach, one is group approach, another is mass approach. Okay, so according to situations, we have to use different types of approaches. Different approaches are used in organizing health promotional activities. Again, the choice of this approach depends upon so many factors. The choice of the approach depends on factors like the size of the target audience. So, for example, if students of the first year MBBS happens to the target audience, if their number is more, then I will opt for mass approach. But again, it depends upon the situation, depends upon the topics, depends upon the issues. Depends upon the nature of the information to be exchanged or disseminated. If sensitive issues are discussed, if sensitive issues are the concern, then no question of mass approach, even no question of group approach, only we have to undertake individual approach. Now, each approach requires different methods and uses different types of materials according to the size of the target audience, according to their literacy level, according to their media exposure. If the size of the target audience is large, then we may not opt for group approach. Then automatically we can opt for mass approach. If the size of the group is small, audience is small, say for example 8, 10, 12, 13, 14, 15 maximum, then we can opt for group approach. Again, at the same time, we have to think about the literacy level. If audience are educated enough, then we can sometimes take the help of the mass approach. Automatically, if we say, then they can understand. But you see, if they are illiterate one, then either group approach or individual approach with the help of the different types of visual materials. I told you about the materials, different types of visual materials. On the basis of visual materials, we have to show the materials. Then they will understand what is what. Now, one by one, I will try to explain. And it's important. Individual approach. Methods like counseling are used during individual approaches. What we have to use in the health facilities like subcenter, PSC, EPSC, or your home visits. As a primary healthcare provider or as a doctor, if you are happen to be placed yourself in any health center, in any PSC or any CSC, then you have to visit the homes of the community people, or when they will come to your health facilities, then you can have the opportunity to use this method, that is counseling. Okay. Now, when you use, these are used for providing information, especially the sensitive issues. That is very, very important. Counseling. The word is not new to you. you have approached the counseling, but yes, according to this approach, according to this our objective, the use of the counseling will be different, the meaning of the counseling is little bit different. So when the issue will be sensitive and when we require to teach complex skills or two-way communications is required, in that case we will use counseling as a method of health promotion. Okay? Communication materials. What type of communication? Three things you have to think. Number one, what are the approaches? What approach will you use? It depends on so many factors. First factor is size of the audience. Second factor is what are the issues that you will be dealing with. If the issue is sensitive, even the target audience is more large, okay? Still, you have to divide the target audience, because you see, if the issue is sensitive, in case of sensitive issues, you cannot disclose the private thing in the front of the other. Automatically, counseling should be used. Now, this is the method. And what the material? Communication materials that we use in these methods include posters. Perhaps you have the idea of the posters? Posters? Poster. Perhaps you have heard the name of the poster? The material? What it is? It's a visual material. Okay. In posters, if you have noticed carefully, in a poster there are different components. In the top of the posters, there is a caption. Title is there, but in our words, we call it captions. Underneath the captions, one message or two messages will be there. Then in the right side, usually one picture will be there. So first part is called, or component is called caption. Second one is called message. See, usually in a poster, single message will be there. And the right side, picture will be there. And in the last, one logo will be there. What is the usual size of the poster? Standard size is there, 2 feet by 3 feet. That is the size of the poster. So posters can be used in counseling sessions, okay, to motivate the people, to persuade the people, or to make the people understand about the importance of these things, and then flashcards. Another material that is called flashcards that you must be used during your group sessions or during your counseling session. Flashcards means different types of cards should be there. Usually different sizes are there. Usually we follow A4 size cards. Okay, card is a little bit hard. In one side, picture will be there, and other side, the points will be there. You will get the points and show the picture to the audience. Then flash it. One by one, you will use these flashcards, usually combined in a topics. That's flashcards. Then clipboard. When these flashcards are bounded in a spiral binding form, that is called clipboard. Then flip chart. If it is book form, that is called flipboard. If it is in the calendar form, spiral, that is called flip chart. You can show. You see, perhaps this flipboard is equivalent to these books that are shown by the MR, medical representatives, while they visit to the doctor. Okay, they can show with the help of this flipboard and other relevant printed materials. Okay. Now this is about the individual approach. Now come to the group approach. Another approach is called group approach. Group approach, there are different methods that we can opt. In case of group approach, first one is lecture. So group approach. Then demonstrations, group approach, group discussions, it's a group approach, panel discussions, it's a group approach, symposium, group approach, workshops, seminar, conference, these are used in group approach. So these are the methods: lecture, demonstrations, symposium, seminar, panel discussions, group discussions. These are the methods that are used in group approach. Why we used to deal with the group? regarding a issue, then according to the situation, according to the different factors, we opt for different methods in group approach. Now, what are the cognitive material? Almost same cognitive material we can use during the individual approach, or rather I can say during the method of counseling, at the same time group approach, like posters, flashcards, flipbooks and other relevant media, and also audiovisual media in case of group approach, including video clipping. And last one is mass approach. Mass approach means when we deal with a large mass, with usually more than 50, 60, 30, 40, 50, 60, 70, 100, 200 like that. Okay. Methods like mass meeting, exhibition, healthcare, etc. are used in mass approach. They are the method. Communication materials almost a little bit different. Poster is hard material, visual material, not audiovisual. Visual means the material that can be seen only. Okay, that can be seen and we can read out, no question of sound. Okay. Posters can be used in case of individual approach, in case of group approach, in case of mass approach. Then leaflets that can be used in mass approach. What is leaflet? Perhaps you know the name of the leaflets? Single page. Usually printed single page we used to distribute to educate, I should not say educate, to what I should say, to aware the people about the issue. We use leaflets. Sometimes you can use it as a educational material definitely among the learned group or among the literate groups or educated groups. Then next is flash. Flash is like a leaflet, but a little bit pictures will be there along with this printout, printing. Then brochures. Brochures you know. Every college has this brochures, every organization has brochures. So with the help of the brochures, we can motivate or educate the people and other relevant printed media along with radio, along with video, along with television and other social media. So these are the different types of approaches. Now, methods used in different settings. We have three settings. One is individual settings, one is family settings. How do you think about the family? We think about the group. Individual, family settings and community settings. There are three settings. In these three settings, we can use different types of approaches, different types of methods, different types of material. What for? To change the health behavior. To change the health behavior of the people. What for? For promoting their health. Or in your words, you can say for improvement of the health of the people. We can use all these materials, all these methods, all these approaches. So different approaches and methods are used to organize health promotion activities and counseling activities at individual level, at family level and at community levels. So activities. When I start my lecture, I narrated or actually I have shown all these activities. But now I have categorized these activities which is for which this individual approach is applicable more and more. Activities like reducing anxious feeling. Later exam, you are anxious always. What I have to do? What will happen during your examination? Then we can offer counseling to make you understand, to help you to realize what is what. Okay? To allow your anxiety, to allow your anxiety feelings. In case of employment, as regards to employment, as regards to love deprivation, etc. And next, to correct the negative thinking also, we use this method, that is counseling. Then, I told you that as I discussed with you about the prevention of excessive use of alcohol, counseling is necessary. With smoking, then counseling is also necessary. Now, today I will try to discuss one method which comes under individual approach. Which method? Counseling. Okay? Now see, there came across the counseling before your admission. But that is different types of counseling and this will be different Okay, counseling. It's very interesting. Counseling is process of encouraging and helping an individual. What for? To identify his or her problem. Many times it happens that a person, an individual, we call client, with a person with a problem we call client. Okay. So these individuals may not be able to identify exactly what is his or her problem. He is facing too many things. He is telling too many things. Okay? He is very anxious. He cannot decide what to do, what not to do. But he cannot pinpoint about what the problem is lying with him or her. So to identify his or her problem, you can help him during the counseling session. That is counseling. To identify his or her problem. Next, to find out the cause and consequences of this problem. Third, the way of its solutions, how we can solve it, and at the same time and encourage to take necessary actions to solve the problems. So these 3-4 points are very important. At the same time, counseling does not mean advice, it means choice. So what is counseling? Counseling is a process through which we can help individuals to find out the problems, to help him to know about the cause and consequence of the problem, to help him to find out the best possible ways and means to solve his problems, at the same time help him or assist him so that they can take actions to solve his or her problem. Don't think counseling is advice. Many times it happens. Counseling means, okay, that is advice. No, counseling does not mean advice. It's a choice. Options will be there. Now it is up to you what options you will take according to your suitability. That is counseling. What is the purpose of counseling? Purpose of counseling is to increase the individual self-realization. Many times it happens that individuals who are facing the problem cannot realize himself or herself. So to increase the capacity of self-realization and to develop their personal resources. Every human being has its own personal resources. Okay? But in the counseling process, the purpose of the counseling is to help the individual so that they can be able to develop their resources or abilities and capacities. What for? For solving the problem. This is the purpose of the counseling. First one is increasing the self-realization. Next one, developing the personal resources. So with these resources, you yourself can solve your own problem. But you may require a guide. That's all. That is the counseling. In many situations, during your work with individuals or client, you can say patient, but we will not say patient. We will say individual or client. Individual, patient means person with a problem. Client means also person with a problem. Okay, there are two types of problems a person may face. One is organic problems that is related to disorder, okay, functional disorder, and another is not only functional. Not only related to organ, but only functional. Okay? For that reason, you always say the client. Doctor or you as a health professional, give you to counseling. What for? Info, to pursue, to motivate the patient or adopting desirable behavior change. Is it? What the doctor do? Say for example, suppose a patient is not taking healthy diet. Doctor tell him what type of diet is required. That means taking diet or constant diet is a habit, it's a practice, it's a behavior. So change the behavior. Doctor will inform us these things you have to eat. Doctor will motivate. If you do not eat this diet, then you will not even survive. Okay? And doctor will persuade the client for adopting the desirable behavior change. The healthcare provider means you should know the principles of counseling and acquire the skills of counseling. Two things you have to know. First, what are the principles of the counseling? Principles means what? The things that you should keep in your mind. And skills means what? What you have to do. So you have to know about the principles as well as you have to know about the skills that you have to practice to help the beneficiaries to identify the source of their concern or the difficulties and find ways and means to help them to deal with their problem faced in another very important faced in non-threatening manner. That is again very important in case of counseling, not in threatening manner. No question of arousing fear, no question of threatening. So without giving any threatening, without showing any fear, you have to motivate people, you have to persuade people for changing the behavior, what their reasons. You have to know the principles of counseling. At the same time, you have to acquire the skills of counseling. Now let's see. There are different formats of counseling applicable in public health, applicable in health situations. Number one is in-person. Counseling does not mean always individual. Small group counseling may be there. In-person, face-to-face counseling in health facilities or during home visits or health facilities. Say for example, a TB patient has come to you, suspected TB patients. Okay? Then you are sending to the dot clinic. Once you will be diagnosed, diagnosis is over, confirmed diagnosis, then again when the case will come to you, so you can say that it's a TB case. TB case or HIV infected person or HIV/AIDS infected person, you have to do counseling. That is the main issues apart from avoiding the medicines. Counseling is most important thing. Next is group counseling. The format. One is individual counseling, group counseling. Group counseling sessions address health issues or problems similar among the people with similar problems and background. For example, simple healthy foods and physical activity. Group counseling can be undertaken for a group of people who are having the same type of problems. They used to use junk foods, they do not do any physical activity, okay? They spend this lifestyle like what I should sedentary lifestyles. So in that case, group counseling is required. Next one is telephonic sessions. Through telephonic sessions also, but you see not in that type of very sensitive cases, but apart from the in sensitive cases, through telephonic sessions, we can do counseling also. These are applicable for individuals who might find it difficult to go to the counselor or to go to the health facility. There is telephonic counseling, telephonic interview we conduct. Example, anxiety arises concerning workplace. So for example, in your workplace, you are working, so somehow you are feeling anxiety during work. So you are not able to go to meet the counselor and conduct and meet the counselor in the counseling sessions, or even you cannot meet the doctors. Even you cannot meet the doctor. So during the sessions, if the doctor thinks yes, telephonic conversation may be there, and the doctor can help you or as a client or as a patient solve your problem. Next is online counseling. Some people do not want to meet the counselor because of some other factors, because they want to hide their identity. In that case also, as a counselor, you can opt for online counseling. Now, principles of counseling. That is very important. I told you two things you have to know. One is principles of counseling, and that is skills of the counseling. Principles of counseling. First principle is very important. All are important, but this is the first principle. Acceptance. Whatever may be your client, you have to accept the client as he really is. That is the recognition of the needs of the patient. You have to recognize the need of the patient. That It is the need of the patient to accept him first. If you cannot accept him as a normal human being, he cannot open his mouth. Whatever may be his feelings, if you accept him, then if he perceives that yes, this doctor has accepted me as a normal human being, he will trust. The doctor is trusting me, then automatically whatever is negative feelings, whatever is pent up feelings, what is negative behavior, everything you will tell. But you see, acceptance does not mean approval. You are accepting the presence that you are not accepting his faulty behavior. You are not accepting. Say for example, a person is using alcohol every day, addiction. You are not accepting this activity, addiction activity you are not accepting, but you are accepting this person as a normal human being. If you can accept him, if the patient can perceive, or if the individual can perceive, yes, Dr. Babu has accepted me as a normal human being, automatically what will happen? He will tell everything to you. Then it will be easy for him to deal with the patient. Next principle is powerful expression of feeling. Again, this is the recognition of the need of the client to express his feeling. Feeling. When the patient will perceive that yes, Dr. Babu has given the right to me to express my feeling, even whatever the negative feeling, kharab feelings, whatever may be. If he can perceive that yes, Dr. Babu has given the right to him, to me, to express, he will express everything. Once he will express everything, then what will you say? What will you think? Yes, everything halka hoye geche. Okay? Then automatically it will be easy for you to treat him, to counsel him. And that principle is control emotional involvement. Though the word is there, control emotional involvement. When the patient will come to you for help, when he is seeking help, emotional component is involved. Emotional component is involved. When anybody comes to you to seek help, emotional component will be there. So you have to feel, you have to recognize the feeling of the patient. You have to recognize the feelings that yes, he or she has the need to express it. You have to sense the feeling and you have to give appropriate response by nodding your head. When you will think, yes, Dr. Babu is emotionally involved, so little bit you have to involve emotionally, but not in uncontrolled way. In controlled way, you have to involve emotionally with the client or with the patient. Okay? But you will not take the responsibility of the client. You have to involve emotionally yourself that much that can help you for the client, keeping your professional attachment, keeping your professional dignity. So that is control emotional involvement. Next is client's self-determination. Everybody knows that individual is by far the best judge. What is good, what is bad for him. Just you can guide him. So you have to, every patient has the right to determine what he will do, what he will not do. It is his basic right. But there is some limitations also. So you have to give the freedom to the client, to the patient to determine what you will do. So for example, can you opt for this one, this one, this one? You can show the different paths. What will be suited for him, he will do. He will choose it. Then only it will be possible for him to solve his problem by own effort. Next one is non-judgmental attitude. Don't be judgmental. He may be thief, he may be robber, he may be ex-patient, but don't be judgmental. In counseling, we cannot include guilt. We cannot assign any bad notion to the client or towards the client. Okay? We cannot say is bad, is good. Nothing is good, nothing is bad. But what you have to think, what is right. Okay? So you should not be non-judgmental. You should not be biased. Next one is individualization. Say for example, many patients may come with same problem, with same types of problems, but each and every individual is different, especially where the disease is psychosomatic. So you have to treat each and every individual the different person. Say for example, young guy has come. Oh, some young guy is equal. No. So you have to treat each individual differently and pay attention accordingly. And last principle is confidentiality. What does it mean? It is the preservation of the secret information concerning the client that is developed within the professional relationships. So you have to maintain the confidentiality. But yes, there are some limitations. Say for example, a HIV patient has come to you. Okay? Then you may not keep the confidentiality among yourselves and the patient. Suppose he is a male patient, automatically you have to convince the patient first, yes, I am disclosing to your wife. You have to motivate the patient, motivate the HIV patient, yes, because it is necessary that I have to disclose it to your wife, because you have to meet your wife. Okay, so please call your wife and I will talk to you. So this is breach of contract definitely, but many times we should maintain the confidence. So these are the principles of counseling. Now, okay, I will take only 5 minutes now. Counseling stages. Recently, in the year 2005, Hackney and Cormier proposed a 5-stage of counseling process. Stage 1 is initial disclosure. Stage one is initial disclosure on relationship building phase. The counseling process begins with relationship building phase. The counselor engages with the client. What for? To explore the issues. At the same time, the client also reads the counselor's verbal and non-verbal communication. What for? To draw inference about the counselor at the central counseling process. What will happen during the counseling process? So every client used to understand what will happen. One client comes to the counselor, then my problem will be solved. But how it can be solved? He can assess about the skill of the counselor at the same time the counseling process. So there are two types of communication. One is verbal communication as well as non-verbal communication. Verbal communication transmits the thoughts and feelings, and the non-verbal communication signals emotions and the attitudes. When the counseling process starts, the counselor engages with the client. What for? To assess the problem, to find out the problem, to know the problem. And nextly, at the same time, the client also try to read the signals. What will happen? Let's see. During this process, it is the duty of the counselor to use his listening skills, important listening skills. Listen carefully and pay attention to the client. Then client will feel, oh, counselor listening to me. Without anything, he is listening carefully my problem. When you perceive, yes, he is listening, then you will try to tell everything. This is the first stage, that is called relation building stage. And stage 2, that is in-depth exploration. In fact, the second stage starts with the first stage. When the first stage finishes, second stage starts. It is also relation building phase, but in-depth explorations. That means in this stage, actually the counselor will try to find out the problem faced by the client. That is the in-depth explorations. And third one is goal setting or commitment to actions. The third stage, in the second stage, exploration will be there. Once exploration is over, that means pros and cons of the case, the counselor will know. Once the counselor will know the cases, know the problems faced by the client, then with mutual understanding, both you as counselor and the client will set the goals. During the counseling process, the objective is to achieve the goal. So that is the goal setting. And that goal must be set in collaboration with the client as well as depends upon the case. Once goal is set, then counselor, both the counselor and the client, mutually understanding state, they will try to achieve the goal. That is called fourth stage, that is counseling interventions. In case of this counseling intervention depends upon the series of factors. First factor is skills of the counselor, skills of the doctor, number one. Number two, nature of the case. Number three, it depends upon the different situations. Usually there are three types of approaches in counseling interventions. One is psychodynamics, and that is humanistic, and there is behavioral. But in public health, we use only one approaches, that is called behavioral approaches. In behavioral approaches, what we do as a doctor, as a counselor, we try to engage the client different types of activities assigned for him or assigned for her to alter his faulty or negative or undesirable behavior. The counselor will help him to engage in different types of activities that will be meant for the client. Once we can be able to engage the client in different types of activity, then we can alter or modify the faulty behavior. Okay, say for example, behavioral therapy in case of say for smoking, some chewing gums will be there. Instead of cigarette smoking, we provide chewing gum to the client. The sensation will be there to alter his behavior. In this way, we try to help people to quit smoking. And last stage is evaluations or terminations or referral. If we cannot solve the problem, then we refer the case. If we think yes, now problem is solved, we try to terminate. It's very critical to terminate. But you see, we have to plan in advance to terminate the case so that there will be no sadness, there will be feeling of pleasure. Okay, that is the last stage of this counseling. Okay, so that's all for today. Any questions? What I discussed? Quickly and ask questions about the counseling, about the promotional activities. That different methods are there. The next class I will discuss about the group approach, different methods, lecture, panel discussions, group discussions, symposium, seminar, everything I will discuss one by one. All of these are the health promotional methods. बुझे पड़ेगा ना? Any question? Any clarification regarding counseling or health promotional activities? Counseling is very important. Okay, it's also counseling or just after slide and make it. Okay, one slide I will show you. That is very important. This one. Then I will finish it. This one. How to conduct a counseling session. That is very important. Personally, you have to conduct a counseling session while dealing with your patients, sensitive cases. Now, how to conduct the counseling sessions? Once the client, all the patients will come, usually greeting. Namaste. Or please come. Take your seat. Offer a seat to the client, or you can say to your patient. Same thing. Okay? Building rapport. Asking general information. From where you are coming, what is your name, in your family, who are there, how it is said. That means, once you ask this question, automatically anxiety will cease. Once the patients will come to a doctor, usually use a tablet. Okay, humbly. So you just build a rapport by asking simple general information. Then lean forward. Suppose you are sitting like this, lean forward. That means once you lean forward, he or the patient will think, okay, he is giving, Dr. Babu is giving proper attention to lean forward like this. Okay, lean forward. Showing concern to non-verbal cues. Non-verbal. Okay, non-verbal cues. Then, listening he to her problem. So, whatever they say, someone is telling, it is not clear to you. He is humbly to tell, he is telling, he is hesitant to tell something else. Okay, we broke. Next, what else? Okay. Show empathy and character. Empathy, you know? Empathy. Put yourself, sympathy, you know. Empathy means put yourself in the position of the patient. And think, if I would have been the patient, what would have been my conditions? That is called empathy. And then paraphrasing, that means clarification. What the patients are telling, you are repeating the same things, but in shorter versions. Okay? In other words, but keeping the meaning intact. That is called paraphrasing. If patients omit something, if patient thinks no, he has told something wrong, automatically repeat the right things. That is called paraphrasing. Ask relevant questions. Once it is over, then you will try to tell. Then tell. You provide necessary information to the patient, what to do, what not to do. Then maintain eye contact. If necessary, turn your eyes. Suppose patients are telling, you are thinking what the patient is telling, it is irrelevant. Then you turn your eyes towards from the client. But otherwise, you have to make your eye contact with the patients. Then at the end, summarize the session. Okay, fix the next appointment. Then relax. Then time. Okay, that is all about conduction of counseling session. Okay, thank you for your presence here.